There is no doubt that strokes are dangerous and deadly. It is the #5 killer and a leading cause of disability in America. This Stroke Awareness Month, I sat down with Doctors Tariq Cass and James Siegler with UChicago Medicine to learn the importance of prevention and early detection.
So back when we were medical students, and we're not that old, actually stroke was the #2 killer, and now it's #5 killer. So we actually advanced significantly, not just with medical therapy, with also surgical therapy and prevention.
But not only is it deadly, it's also quite debilitating, wouldn't you say?
That's right, and the important thing is, although we are preventing deaths, patients are surviving more with disability and with ongoing stroke risk factors. So monitoring and moderating those risk factors is important to secondary prevention.
Which is why we need to know the 5 signs of stroke. Can you go over that for us?
So it's very simple to remember, fast. F is for face. So you ask your beloved one, can you give me a smile? And if you see like they're twisted in their mouth, that's a sign of a stroke. A is for arms, so just simply ask them to raise their arms up like this. And if you notice that one arm you cannot raise at all or it keeps falling, that's also a sign of a stroke. S is speech. Look at their speech. Ask them to say a sentence or two. And if they cannot produce words or they do not make sense or their words are very, very slurred, that's also a sign of a stroke. And finally, T is just like time is of essence. Like we keep saying, time is brain. So it's a 911 call. A lot of people we face, unfortunately, that they like to sleep it over and they'll see what's happened by the morning. No, these are the patients that get hurt the most. When you see symptoms of stroke, it's a 911 call immediately.
No time to waste. And women are most at risk for stroke in the debilitating factors?
Well, women can live longer than men on a population level, but it doesn't necessarily mean that the average 50-year-old woman is at a higher risk than men for the most part. Risk factors are common, and we just have to make sure we address all the risk factors like high blood pressure, seeing your doctor for that. If you smoke tobacco products, trying to avoid those when possible. That's an easily preventable risk factor. High cholesterol, obesity, all those factors are all addressed in the primary care
And
office.
also being aware of that while you're pregnant. Yeah, preeclampsia and the gestational diabetes issues and different things like that. Now, when looking for a stroke center, the University of Chicago is the place you should be, right?
We are proudly the first center in Chicago to be certified as a comprehensive stroke center. What does comprehensive means? That means it's a simple example, it's a one-stop shop. So we provide prevention, we provide acute imaging, acute recognition of stroke, the best medical therapy, the best surgical therapy, and the best access for rehab.
But before you have to come to UChicago, there are things you can do at home to prevent this, correct?
Correct. That's, again, seeing your primary care doctor, following up with your care providers and making sure your risk factors are modifiable. And then recognizing these stroke symptoms, like Dr. Cass mentioned, is very important because stroke can happen to anyone at any time. It could be a 20-year-old or it could be a 90-year-old.
And you mentioned there have been advancements in therapies for treating stroke victims, correct?
Yes. For example, I do procedures, we call them thrombectomy. It's a simple procedure that nowadays we go just from a small artery from here and we're able to push catheters all the way to the brain and grab the clot and get it out. It's important to come to our hospital to be able to do this therapy, which again increased significantly the chances of living, but also decrease disability.
All right, grab your phone to scan the QR code on your screen and find more information about UChicago Medicine. You can also book an appointment with UChicago Medicine stroke doctor by visiting uchicagomedicine.org/stroke, or you can call the number there on your screen.